Recording in progress.
Well, good morning, and thank you for joining us for today's press conference. If you need access to record or would like to ask a question, please indicate so in the chat. We will limit questions to one question per outlet today, and we are limited to 45 minutes. If there are remaining questions in the queue when we conclude and you feel your question hasn't already been answered, please submit your questions in the chat and we will work to get you a response in writing. We will begin in just a few moments after we grant recording permissions. Okay, I believe all the permissions for recording have been granted. If you requested permissions in the chat, you should now be able to record. If you still need permissions granted, please leave us another message in the chat. Dr. Vanderhoff, we will now hand it over to you to begin today's press conference.
Well, good morning, and thank you for joining us today. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. It's been a few weeks since we've had an update, and that's because our COVID-19 picture has been fairly stable. Now, it's true that COVID-19 cases have increased nationally and in Ohio in recent weeks as a result of Omicron and its subvariants. But as always, it's important to put the numbers into context. The virus is still out there circulating for sure, but Ohio's case totals remain a fraction of what they were in January. Now, we recognize that some of this is because fewer people are now getting tested or they're not reporting their test results. That is certainly a factor. But even taking that into account, it's clear from looking at the numbers that we're still doing well when it comes to the volume of severe disease we're dealing with. The number of people hospitalized with COVID-19 in Ohio is currently 582. And that compares with a peak of over 6,700 on January 11th, according to the Ohio Hospital Association data. Now, based on my verbal communications with colleagues, it also appears that many of those admissions are for other reasons among patients who also happen to have COVID. And the weekly average for deaths in Ohio has declined 16% over the past 3 weeks. What this tells us is that immunity, especially from vaccines, is making a difference. About 2/3 of eligible Ohioans now have at least started their vaccine series, and more than 60% have had 2 doses. While, of course, we want to see more eligible Ohioans fully benefiting from vaccination, this and some level of post-infection immunity among those who've contracted COVID-19 have combined to create a substantial level of protection against severe illness. This underscores the wisdom of the Centers for Disease Control and Prevention adopting its COVID-19 Community Levels Index, which takes into account more than just case counts, but also hospitalizations and percentages of hospital beds occupied by COVID-19 patients in each community. On the latest CDC community levels map, all but one of Ohio's 88 counties is green, signaling a low level Lawrence County is yellow or medium. Nationally, more than 81% of counties are green and only 4% are orange or high. This is good news as we head into warmer weather, but we need to take this opportunity to prepare for the fall when more of us are indoors, or to prepare for unanticipated changes in viral activity. We need to be asking ourselves right now, how can we fully prepare for the future to protect ourselves from severe illness? Now, the best and safest way to prepare our immune system remains vaccination, especially keeping your vaccination fully up to date. Now, for most people, that means a 3-dose series. Some may need additional doses, which we'll talk about with our guest a little bit later. And when you look at the cases that are requiring hospitalization for the treatment of COVID-19, they're primarily people at the greatest risk for severe disease, those of advancing age or who have serious underlying medical conditions impacting their immune systems. For that population, we have another important option, and that's therapeutic treatments. We're fortunate to have some very effective therapeutic treatments right now. In general, these treatments are designed to help people who have become infected fight the virus off, and especially to help high-risk people who get infected to avoid severe disease. Now, these therapies, like so many medications, can interact with other prescribed medications or affect or be affected by changes in vital organ function, like those of the liver or kidneys. As a result, determining whether an available treatment might be right for you really requires a medical provider to assess your individual circumstances and situation. Your medical provider has the training needed to help make the right decision regarding whether a COVID-19 therapy would be appropriate for you, and if so, which one. Now, in order to help with this process, the Ohio Department of Health continues to expand our network of sites able to provide these treatments, and also continues educating and informing both medical providers and the public about the benefits and availability of therapeutics. Now, on the first point, we feel the state has a strong infrastructure of sites able to provide these agents. These include hospitals, federally qualified health centers, retail pharmacies, and long-term care pharmacies in 87 of our 88 counties. We'll continue efforts to grow this network, and we're currently registering more urgent care centers. Also, to support our medical providers, we had a webinar earlier this week in which medical experts helped give providers across the state the information they need to better understand therapeutic options and current best thinking about the medical decision-making surrounding those. Secondly, we now have on our website an easy way for people to access information regarding where to go to get tested or be evaluated for potential therapeutic treatment. The way to access this is to go to the new COVID-19 testing and treatment page at coronavirus.ohio.gov. Among the resources there are state maps showing the locations which have therapeutic treatments available. That includes a map of one-stop sites called Test to Treat locations, where patients can get tested, get a medical evaluation, and if appropriate, receive treatment. Now, in thinking about these therapies, I think it will be useful if I briefly summarize the major therapeutic options that we currently have at our disposal. First are monoclonal antibodies, and for the most part, we're currently working with two, bebtelovimab and Evusheld. These are medically manufactured antibodies given to help our immune system in its effort to fight off viruses. Now, bebtelovimab is currently the only monoclonal effective against the BA.2 subvariant of Omicron, which is what we're seeing the most of here in Ohio. Bebtelovimab is administered through a single IV infusion that lasts approximately 30 seconds, and it should only be administered within 10 days of symptom onset. Evusheld, on the other hand, is a protective antibody, meaning it's intended to prevent disease among vulnerable people with severely compromised immune systems before they're ever exposed to COVID-19. Evusheld is given as an injection into the muscle, and it may provide protection for up to 6 months. Then there are antiviral medications, which work to keep the virus from replicating properly, and as a result, give your immune system an upper hand in fighting the virus. Now, currently, the most important of these is Paxlovid, and it comes in pill form. The treatment course of Paxlovid, though, has to be initiated within 5 days of symptom onset. This makes it imperative that people who want to get treatment get tested as soon as they think they may be infected. And then, of course, to work with a medical provider as quickly as possible if they test positive. Now, we want everyone to understand that especially for people in vulnerable and high-risk categories who are more likely to get sick despite vaccination or past infection, therapeutics are a vital tool in our battle against COVID-19 because they may prevent an initially mild COVID illness from getting more severe and landing you in the hospital. Now, it's important to note that therapeutics are not for everyone, and they certainly shouldn't be seen as an alternative to vaccination. Getting the vaccine and appropriate follow-up shots really should remain the foundation of protection against severe illness from COVID. And remember, your provider remains your best guide to your health. The Ohio Department of Health will continue to work with providers to communicate and help them feel comfortable prescribing therapeutics, even as the virus and available options for treatment continue to evolve. Now, joining us today to further discuss vaccines and therapeutic treatments is Dr. Joe Gastaldo, Ohio Health's Medical Director of Infectious Diseases. Dr. Gastaldo, thank you so much for joining us.
Thanks for having me, Dr. Vanderhoff.
Dr. Gastaldo, we routinely now are seeing people who are vaccinated going on to develop symptoms of COVID. And I often get the question, does this mean our vaccines aren't working anymore?
Dr. Vanderhoff, that's a great question. So we have to kind of go back to the beginning of the vaccines. These vaccines were intended to prevent people from dying and from being hospitalized. And in that metric, in the setting of being up to date with your vaccines, meaning that you get a booster, the vaccines are still performing extraordinarily well of keeping you out of the hospital and preventing you from dying. So yes, the vaccines are working well. They were never intended to stop all infection.
Yeah, thank you. Well, we've been going over therapeutic treatments. I just mentioned a little bit about those, but the remaining question is, who are they really best for? Who should be getting these therapeutic treatments?
Yeah, so the therapeutic treatments you just mentioned, specifically Paxlovid and the monoclonal antibody Bebtelovimab, they are really for anybody, regardless of their vaccination status, who has a high-risk condition. And when you look at the collection of high-risk conditions, there are things on there that we're all very familiar with, like diabetes, heart disease, lung disease, liver disease, kidney disease. But there are also other things on there too, like physical inactivity, people with neurological conditions, people who are disabled, people who are overweight, people who are living with substance abuse disorder. Those are all at-risk conditions, and those are all a part of the population that qualify for these outpatient treatments if they do get COVID.
Yeah, Dr. Gastaldo, what about finding a treatment site with available medication? You're a specialist in infectious diseases, and I'm sure you run into this question a lot. Could you walk us through that process at a high level?
Yeah, so I think from a patient perspective and what we really need to tell people in the public, you need to have a plan in place. If you have a high risk condition, you really need to have a plan in place. Number one, what is your access to get testing? There are plenty of home tests that are out there. The supply chain for them is very good at this time. So the first step is if you have symptoms, stop what you're doing and get tested. The second thing is if you have a high risk condition, what is your plan to get access to these outpatient treatments? What does that look like for you? I would really want high risk people to really be proactive and have those discussions ahead of time with their healthcare provider or to find out together with their healthcare provider if they qualify for those. You mentioned before that Paxlovid, one of the medications, does have some drug interactions and some other clinical considerations. Think about those ahead of time. So, for example, if there is a drug interaction that cannot be managed with Paxlovid, you would automatically go to the other treatment, monoclonal antibodies. But we really want people to have a plan in place. And really, now's the time for at-risk individuals to think about what that plan is and to work with your healthcare provider on figuring that out before you actually have COVID.
I'd like to just shift with this next question a little bit in the direction of vaccines. And of course, we received the news that the FDA has taken a step in the direction of opening up a third shot or the booster shot for people 5 to 11. And I think more and more, many medical providers are really thinking about this as a 3-dose vaccine for most people. But, there's then that so-called second booster or fourth dose. And of course, some people have a primary series that is more than 3 shots. How can you help people think about who should be getting additional doses?
Yeah, thanks, Dr. Vanderhoff. That's a great question. So moving forward, I want everybody to get their vaccine because I want you to have the protection that's going to prevent you from dying or being hospitalized. Now, right now, the CDC guidance is we want everybody to be up to date on their vaccines. And for most people, that does mean now 1 booster shot. There are other individuals where they should really get more booster shots, such as those with weakened immune systems. And also, too, as you get older, your immune system also ages and you don't get the same type of immune response. So right now, there is a second booster or a second shot available, and anybody who is 50 or older does technically qualify for that. I think in the context of the advice I give my patients and other healthcare providers, I think if somebody is older, the second booster does make sense clinically. I think if people have more than one comorbid condition, obesity, diabetes, heart disease, I think it is reasonable to get a second booster for those individuals. It boils down to this. There is no identified risk of getting a second booster. And if anything, that second booster may provide an additional layer of protection for those who are frail with underlying healthcare conditions.
Thank you so much, Dr. Gastaldo. I'd like to share a change that reflects some declining demand for COVID-19 services that are provided by our call center. Since very early in the pandemic, our ODH COVID-19 call center has been operating 11 hours a day, 7 days a week, including holidays. But for a while now, our call volumes have significantly declined, especially during non-peak hours. So our website also has evolved and is now full of COVID-19 related information and has answers to most of the questions that we are in fact still getting. As a result, effective Monday, May 23rd, our call center hours will be adjusted to Monday through Friday from 9 a.m. to 5 p.m. The call center will be closed on weekends and state holidays. Of course, if circumstances change, we'll be ready to shift as needed and can easily, once again, expand our call center hours. Now, I also want to address an issue that is front and center in many families' minds these days, the national shortage of infant formula. The Ohio Department of Health is very concerned about this nationwide shortage, and we're doing all we can to help families who may be affected. We've been communicating directly with formula manufacturers who assure us they're working to meet the demand and address the shortage. In the meantime, the Ohio WIC program, which helps women and their infants up to age 5 who are at risk for inadequate nutrition, has been working with federal agencies involved in the oversight of the program, as well as formula manufacturers, to mitigate the impact of this nationwide shortage on our infants right here in Ohio until production is fully restored. Now, many participants in the WIC program, in fact, have medically complex needs and are on prescription formula. WIC actively works with dietitians and healthcare providers to help find the best options to keep these infants healthy. In addition, the WIC program has, in collaboration with federal agencies, implemented several strategies to help families during this time, including adding flexibility for formula choice, including allowing different sized cans to be purchased for some impacted specialty formulas. At the local level, WIC staff are working closely with impacted participants to help them obtain appropriate formula, including connecting with physicians and retail outlets to problem solve and identify available options. As families navigate through this national shortage, there are a few very important points to remember as they explore their options. First, we strongly warn against any attempt to dilute your formula or to make homemade formula. These are just not good options. If your child is on a specialty or medical formula, call your child's healthcare provider to ask about adjusting their prescription to an appropriate alternative formula. Consider calling the store to ask about product availability. If you don't see the formula you need on the shelf, consider kindly asking a store associate for assistance. And of course, you can also call your local WIC office for additional assistance. In conclusion, I believe Ohio is well positioned to confront future challenges from COVID-19, in part because of all that we've learned and implemented over the last 2+ years. We've created robust public health partnerships. We have effective vaccines and boosters, and now we have very effective therapeutic treatments. But while we're in a better position to confront future challenges, we can only really be successful if we utilize the tools at our disposal effectively. It's important for Ohioans to do our part by staying up to date with our vaccines, by following CDC recommendations if you develop symptoms, and if you're immunocompromised or at high risk for severe disease, to have a plan, rapid testing, and to talk with your provider about whether therapeutic treatments might be right for you. As I've said before, although COVID-19 isn't going away anytime soon, we more and more have the tools to live with this virus much more effectively, provided we utilize the tools we have effectively. So if you're unvaccinated or your vaccine isn't up to date, there is no better time than now to get vaccinated. And as Dr. Castaldo recommended, now's the time to make plans in consultation with your medical provider regarding testing and treatment options if you become ill with COVID-19 in the future. So thank you. And with that, Ken, I think we can open it up for media questions.
Okay, thank you, Dr. Vanderhoff. Our first question today is from Sarah Shookman with WKYC.
Good morning.
Good morning.
Thank you for the update. I know yesterday we saw the FDA approve booster shots for the 5 to 11-year-old age group. Can you give us any update on what you're hearing about vaccines for those under 5? And I know we have a fairly low percentage of school-age kids also vaccinated. So do you think this booster will have an impact in the state? Thank you.
Yeah, so let me first great question. Let me first expand a little bit on where we stand with regard to the 5 to 11-year-old population. As you noted on Tuesday, the FDA amended the emergency use authorization for the Pfizer vaccine, allowing it to be administered to that population of 5 to 11, at least 5 months after completion of their primary series. The next step will be for the CDC to also authorize then its clinical use, its clinical application. And we do expect that will likely come soon. Provided the CDC recommends it, this will now be the first booster recommended for this age group. And I think that is a great step forward. We have seen very good clinical response and safety in this age group. It is true that this does not yet address the pre-K age group. And while I can understand that there is a certain level of frustration for some parents about that, I think that what we see the FDA and the CDC doing with the vaccine should actually give them real confidence in the seriousness with which they are taking their studies around safety and efficacy, and that we continue to not cut corners when it comes to assuring that the scientific evidence is fully complete and ready to tell us that these are good options. I would say the medical community, and looking at the data that we have so far, fully presumes that these will be eventual options for the pre-K age group. But I think we are also collectively very supportive of continuing to follow the rigorous standards that have served us so well so far. Dr. Gastaldo, this certainly is in your wheelhouse. What would you add?
Yeah, a couple things, Bruce, and I think you said it. We don't want to cut any corners at all in the review process. We want the data to be presented in the same manner as any other vaccine. We don't want to cut any corners. I don't have the actual date off the top of my head, but I know the FDA does have a planned review date sometime in June for the pediatric vaccine clinical trials below the age of 5. So I feel confident that that process is moving forward, and we will likely have that vaccine available sometime this summer or late summer, perhaps before they go to school. So stay tuned on that. But the FDA does have an announced review date for the vaccine review for those below the age of 5.
All right, our next question will come from Dan DeRoos with WOIO.
Good morning, Dr. Vanderhoff. Good to chat with you again.
Good morning.
I'd like you to put into perspective, and I think you started to address this at the beginning, where we are now compared to, say, January 3rd, when we were at 32,000 cases in a single day. Can you take us back to January, now that you've had some time to think about just how in trouble we were as a state?
Yeah, thank you for that question. There was no question that where we sit now in dealing with the virus is a much better place than where we sat then. What we were facing in January was in many respects a perfect storm. We were still not yet done dealing with a variant that was closely related to the variants that had come before it, the so-called Delta variant. It had driven a lot of illness, especially serious illness, filling our hospital beds. And we were among the very first places as this virus migrated out of South Africa to other parts of the world. We were on the front end then of having the Omicron variant hit us. And Omicron hit us before Delta was done with us. So, and what was different about Omicron was that Omicron, from a genetic point of view, looked very different than Delta. And so very often, people who had just gone through perhaps having a Delta infection were fairly vulnerable to also getting an Omicron infection. So it truly was a double hit in a short interval. However, if we cycle ahead to where we are now, we have a combination of ever increasing percentages of the population who are vaccinated. I've shared some of those numbers before. Again, from a medical point of view, the safest and best way to build that foundation of immunity. Plus, we have some significant numbers of people, especially young people, who have demonstrable current immunity related to the first Omicron variant, the BA1 variant, that crosses over and is protective against some of the subvariants that we're currently seeing. So from an immune point of view, better spot. In addition, when we were in the winter, we were at the beginning of really having the kind of availability of effective therapeutics that we've been in need of. Now we're in a much better position in terms of therapeutics. And therapeutics offer then that next step. People who get infected, regardless of whether they have had past infection or vaccination, now have this option that's very effective at keeping them from going on and having their illness become very severe. So you put that all together, and we're now in an era where increasingly I see it as being up to us regarding whether we're going to be prepared to beat COVID-19. Dr. Gastaldo, I think, described it very well. It's now about having a plan. Have I planned to keep my vaccination series up to date? Should definitely do that, check that box. Then, have I looked at my medical condition? And if I am at higher risk for getting hospitalized, higher risk for developing severe disease, do I have a plan in place to get tested and to work with my provider to make a determination at that time whether getting one of these therapeutics is in my best interests, and then getting that prescribed? So, Dr. Gastaldo, I know I in part covered some of the response I know you would have to this, but anything you would add regarding this very important question?
Yeah, so back to the original question, I could tell you hospital this past January was very challenging. It affected on how we deliver non-COVID care. There was delays in surgeries, elective surgeries, and it was quite challenging. Here at Ohio Health, we had a big input from and support from the Ohio National Guard. We're very grateful for that, but it was very challenging. And I just want to reiterate, things are very different today than what they were in January. We have the infrastructure and the tools available for people creating that plan. Just to recap, what is your plan to get tested if you have symptoms? If you have an at-risk condition, what is your plan to get the treatments? Many people really don't know what the at-risk conditions are. And we really need to get that messaging out to the public to get that plan in place moving forward.
Okay, our next question comes from Mariel Carbone with WCPO.
Hi there. I know you went over a lot of numbers being down. We have the low transmission rates right now, that drop in hospitalizations. So as people move into summer and kind of trying to make the best decisions for their family, what number would you guys suggest they look at most to make decisions when it comes to vacations or other plans?
Yeah. One of the things I think is important to recognize is we actually are seeing indications of a fair amount of transmission of this virus happening right now. And in fact, if we were just looking at case reports, we have counties in Ohio that would qualify under our past measures as being communities of high transmission. So this virus is circulating. But for all the reasons I described before, the right way to look at the impact of the virus now really is through the lens of the CDC's community levels. And I would ask people to look in that direction to understand what risk looks like at this time in their community. And fortunately, all but one of our counties, as I noted, is in the green category. Now that what is not a reason to not think about COVID-19 or to think that this is behind us. What both Dr. Gastaldo and I are saying very clearly is Well, COVID-19 is there, and COVID-19 continues to pose a threat. And I think we both anticipate there's a real risk of an increased threat in months to come. But the game changer is that we have an array of tools now that people can and should take advantage of to reduce the potential impact of this virus on their personal health, to help assure that if they get COVID-19, it's more of a mild to moderate illness rather than something serious that puts them in the hospital. And that's a combination of vaccination with boosters as needed and a plan for testing and therapeutics. Again, this is an infectious disease question, Dr. Gastaldo, so I'll give you the last word.
Yeah, so just to reiterate Dr. Vanderhoff's comments, the CDC has a different type of map out based on community level, and it's based on a couple things, but a bigger emphasis on actually what's going on in the hospital. COVID is out there in the community. There is community transmission of COVID happening, and it is happening higher in the state of Ohio. However, we have to follow the CDC guidelines. And right now we are green. It doesn't mean the virus is not there. And we also have to be cognizant too, that for some people in the community, those at risk, those are immunocompromised, it is safe and it's actually recommended for them to wear a mask. And I do have patients that I take care of who are immunocompromised, they're vaccinated, they're double boosted, they have a plan in place. And still for them, the right thing to do is to wear a high quality mask in public. And there are still those public health recommendations on wearing masks when we get to high community level. And I hope we don't get to that point in Ohio, but we have to be transparent and honest with people that could be the case, but nobody can really predict what may or may not happen in the future. But the point is, we have the tools available today. We need to be on point with following the guidelines that are put out by the Centers for Disease Control on mitigation recommendations.
Our next question comes from Candace Price with WHIO.
Good morning.
Hi, good morning, everyone. Thank you both for doing this for us today and giving us this update. My question is going to be about vaccines. We're talking about we're not at high risk right now, but we are seeing this variant spread across the country and across our state. How is our vaccine currently holding up? I know you mentioned some of the other treatment options that we have and that people need to be properly boosted, but are we seeing that that's still holding up, or are we needing to look at a different update to the vaccine or something like that?
Yeah, that's an excellent question. And I'll begin by saying at a high level, our vaccines are continuing to do a very good job at what they were designed to do, which is protect us from severe disease. These vaccines, because of the way our bodies interact with this kind of virus, we're not designed to really prevent a person from ever getting an infection. What they're designed to do is enable your body to have the kind of strong response that's needed to prevent that infection from getting very severe. And the reason for that is what they essentially do well over time is prepare the cells of your immune system to be ready to go. And it can take those cells a few days to ramp up in response to an infection. What they're not designed to do is keep your antibody levels at very high levels perpetually. And so we do see, after a period of months, people who may have been vaccinated still able to get the infection. A key to it, though, is, as true for any vaccine, is to keep your vaccine up to date. You know, your tetanus shot doesn't last forever. There's a reason why after a certain period of time, if you get a cut or, step on a rusty nail and go see the doctor, they say, hey, it's been a certain amount of time, I'm going to give you a tetanus booster. So as is true for every vaccine, the vaccine only works if you make sure you're following recommendations for being up to date with your vaccine. And so for people who are in fact up to date with their vaccination, the numbers both here in Ohio and nationally continue to point towards highly effective vaccines. Dr. Gastaldo, anything to add?
Yeah, thank you, Dr. Van Hoff. I think it's very important to really emphasize that people need to be up to date on their vaccines. When you look at information from international countries, specifically Israel, for elderly people, if they are not up to date with their vaccines with a booster, that they were more likely to be hospitalized. And I think when it's all said and done, we will probably say that for people to complete their primary series, it is a 3-dose series. So the vaccine, just to answer your question, just to summarize, the vaccine with a booster shot that we are now using is performing very well and protecting against severe disease.
Our next question comes from James Pitcher with WKRC.
Good morning.
James, yeah.
Good morning. It's James Pilcher. I'm sorry, I was muted. I had to unmute. It's James Pilcher with Local 12 here in Cincinnati. We are seeing numbers overall rise in Southwest Ohio. Are you also seeing the overall numbers? What are those overall numbers? And do you have any sense of what the current positivity rate is? And as a follow-up, you're talking a lot about vaccines and boosters. If, say, you've had the 2-dose protocol, then got COVID, do those antibodies that you've gotten from having COVID work as immunity as well? So I know those are two different questions, but if you could talk about the overall numbers that you're seeing, positivity rate, and then antibodies. Thank you.
Sure. Well, so first of all, actually, as I noted at the beginning, we absolutely are seeing overall numbers here in Ohio and nationally increasing after there had been a period of steady decline. They do not appear to be going through the kind of exponential increase that, of course, we saw at one point at the beginning of the Omicron wave back in the winter, but we have seen an increase. The challenge of relying, though, just on cases, on the number of people who are positive, was identified by many health care experts, including the CDC, before the development of their community levels measure. And that is, it's very hard in an era of easy access to rapid testing, which is a good thing, to rely on the numbers that of cases the way that we could at the beginning of the pandemic, when largely these were tests that were being conducted exclusively by healthcare delivering facilities, and those numbers were reliably and automatically reported. So if anything, I think we would assume that the numbers that we're seeing across the state are higher than what's being reported. And if you want the specifics for any given time, again, that's available on our website, and you could go there today and pull those numbers down. But you'll see that we do see increases in numbers. The important thing to remember about that, though, is context matters. And what we really need to understand is not just how much virus is out there, but how much of a burden of severe illness is it creating. And that's where the community levels paradigm, the measurement that the CDC posts for every county in Ohio is so helpful. And you can go and look at your county and see how much of an impact of severe disease in the context of the viral transmission is happening. Fortunately, right now we're all green. We'll continue to watch that, and obviously that could change over time. But we're not without tools for influencing that today, the way we may have been much earlier in the pandemic. We have two powerful tools. One, again, keep that vaccination up to date. And secondly, especially if you're at high risk for entering hospitalization, talk to your provider early when you test positive about the possibility of getting on a therapeutic. And you had a second question, and I'm sorry, I in answering your first one, forgot.
That's fine. I appreciate that. What about, if you've had 2 doses of the vaccine and then got COVID?
Oh, yeah.
Does having COVID kind of count as an immunity or as a vaccine, or should you still get 3 or 4 boosters?
So I'm going to answer this at a very high level and then turn it over to our infectious disease doctor so that he can provide you a more comprehensive answer. Look, one thing that we do know is that our vaccines protect us very, very well and very safely. We also, though, now do have emerging data that is continuing to confirm that, yes, having had infection also provides a level of immunity. Of course, if you get that infection without having the benefit of protection from a vaccine to begin with, you're kind of increasing your risk of having severe illness, I think, unnecessarily. But we have seen, for example, antibody levels post-Omicron be relatively high across populations in Ohio. Those data have been posted by the CDC. So when we look at our young population, especially our very young population, we've seen antibody levels in the 70, 80, 90% ranges that they've developed. And we know that those do offer a meaningful level of protection. They do rev up our immune systems. But again, when we are thinking about what's the safest, most reliable approach, I mean, that continues to clearly be vaccines. Dr. Gastaldo, again, this is very much in your area of specialty. What else would you add?
Yeah, thank you, Dr. Vanderhoff. That's a great question and something that I get asked often. So first of all, we want to say that getting COVID is not a substitution for the vaccine. And we also know too, however, that your immune system actually does get stimulated very similarly to the same way as a vaccine. With Omicron, it's a little bit different. Yes, you get a high antibody titer, but those antibodies come down quicker and they are less protective against a recurrent infection after having infection. So the CDC guidance is kind of clear on this. If you have had COVID, it is reasonable to wait for a period of up to 90 days to get your booster shot if you are due for a booster shot. But nonetheless, though, that is a great question. And I think it's reasonable to wait 90 days, but I would still want everybody to be up to date with their vaccine.
Okay, our final question today will come from Karen Kassler with Ohio Public Radio, TV Statehouse News Bureau.
Good morning.
Are you there, Karen? All right, we'll move on then to our final question coming from Titus Wu with the Columbus Dispatch.
Good morning.
Good morning, doctor. I just wanted to confirm, in terms of, you talking about the baby, infant formula shortage.
Yeah.
You said that Ohio has, is Ohio currently in the process of applying or has already received confirmation of applying for waivers at the federal level in terms of expanding flexibilities for WIC so that, these low-income mothers can have more options in terms of choosing kind of the size and the brand of their formula? And I guess why has it, because I believe Ohio is one of the last few states to actually do that. Why has it taken this long?
Yeah, well, one of the things to understand is that actually Ohio's WIC program is not a client of the manufacturer that has the problem, Abbott. We're actually a Mead Johnson customer. And Mead Johnson actually has been able to produce and has in fact recently increased their production by a significant amount. Nevertheless, at our request, at ODH's request, to the USDA, we have been given approval to apply for additional waivers that are available through the USDA. So we're doing this out of an abundance of caution, recognizing again, we are not a state that is contracted with Abbott, the company that has the production issue. We're a state that is contracted with Mead Johnson. So while additional waivers may not have an immediate impact on our WIC program, this will put Ohio in a position to possibly provide more options and flexibility to families who are in the WIC program. And we are encouraging USDA to continue to reduce administrative requirements and to allow the states to provide the fastest and most flexible response to the shortage. I'd also add that there are a number of helpful resources available to all parents, whether or not they are WIC participants. One of these can be found at the U.S. Department of Health and Human Services webpage, which is hhs.gov. And if you go there and type in formula at the top under I'm looking for, the first link is a fact sheet with a lot of information. And included in that information is a call line to Abbott, the one manufacturer I mentioned. But the other manufacturer I mentioned, Mead Johnson, has a searchable store locator at enfamil.com/store-locator. And now you'll need to type in the specific product you're looking for, but then it will direct you to which stores have that product. In addition, we're setting up our own webpage on the ODH site that should be operational very soon. And this will also provide tips and resources. I think it's, of course, a very, very important issue. And anytime you have one manufacturer have a problem, it affects the overall supply. But of course, as I noted, the situation in Ohio is distinct from that of other states.
Just to confirm, you've applied for those flexibilities. Am I?
That is correct.
Okay. Thank you.
Okay, I want to thank all of our guests today. And Dr. Vanderhoff, do you have any closing remarks?
Again, I want to thank everybody for your time. And I want to just emphasize the point that COVID-19 is not done with us yet, but we have tools in our hands that can help each and every one of us protect us from this virus. Not only vaccination, which remains vitally important as the foundation of our protection, but also having a plan for testing and treatment with our provider, especially if we're at high risk for hospitalization. So thank you all very much. I appreciate your time and attention.
All right, this concludes today's press conference, and thank you again for joining us.